is a dream that might come true, but now, because of huge medical breakthroughs, more and more couples are able to conceive. Please welcome back to the show Dr. Stefan Krotz with Advanced Fertility Center of Texas and his patient Paula Barden, who is in our audience with us this morning. Dr. Krotz, we're hearing so much more about women having fertility issues. Right. Is it because we have more problems today, or we're able to identify more problems today, and plus we're having children later?
I think it's a combination really of both. One of the biggest things that affects fertility now, which wasn't as much of an effect earlier, is that women are waiting longer to have their children. And a lot of that has to do with women wanting to have careers and to get everything established. And actually a lot of careers now require more education, so women are waiting longer to have children.
Yeah, all kinds of reasons why they might not be able to conceive. Endometriosis is something that's pretty common. Tell us what that is and how that affects fertility.
Well, endometriosis is when the lining of the uterus actually spills out of the uterus, out of the tubes, and then starts to grow into the pelvic cavity. And how this can affect fertility is that all the lining that's growing now in the pelvis causes a lot of inflammation. It can scar tubes and damage the ovaries, and also cause problems for the sperm to meet the egg.
Yeah. Okay. Paula, when did you first realize that you all were having problems conceiving?
Well, we've been married 12 years, and so it took we've been trying for like 8 years.
Yeah.
And so the first time we tried IVF, they found the endometriosis. And so we had surgery.
It's really tough because a lot of times women, we just assume it's natural, we're going to have a child, and we spend part of our life trying not to get pregnant.
Right.
And then you're like, now we're ready. I found my soulmate and the whole bit, now we're ready. And it gets really frustrating when it doesn't just happen. Tell us a little bit about that journey.
Yes, the first time we tried IVF, it was unsuccessful, so of course that was devastating. And then I had surgery, and I had to recover from the surgery. And we tried the second time, it was unsuccessful again. And the third time finally worked, and so it was probably a 3-year process.
Yeah. And Dr. Krotz, it's not a perfect science, but what you have to identify, there's like a checklist of all kinds of things. We talked about earlier, it can even be that someone's hormones is off, but you have kind of a checklist you go through to try and figure out where to troubleshoot, basically.
Right. So the 3 basic things that we check, one are that the uterus and the tubes and the ovaries are functioning normally. We check to make sure that all the hormones are at normal levels. And then the third thing we check is to make sure that the partner's semen analysis, sperm count, movement, and everything is all within normal. Is all normal.
Yeah, because oftentimes we think the woman is the problem, you know.
Right.
But tell us kind of percentage-wise where that lies.
So 40% of the time, actually, the male can be the issue in terms of getting pregnant. So that means the other 60%, of course, is female.
Yeah.
So guys really are not off the hook.
Yeah, because oftentimes it can be female and male. Both partners can have a problem. All right, so let's talk about the treatment process for Paula.
Okay, so Paula underwent a cycle of IVF first, and then her symptoms suggested that she may have endometriosis. So surgery was performed, specifically what's called a laparoscopy, and that's when you look in the abdomen with a small camera, and you can find endometriosis, and the endometriosis are little growths that will grow on the uterus, on the ovaries, on the tubes. And a lot of times during the surgery, the endometriosis then will be cleaned off of the tubes and the ovaries so that there's less inflammation in the pelvic cavity, and then we can go ahead and perform in vitro fertilization.
Yeah, and some of the symptoms of endometriosis may be infertility is one, but extreme menstrual pain, pain between cycles, pain within, of course, bladder, bowel symptoms, all those types of things can be an indicator. So if you know you're dealing with that now, you might want to come in to a specialist and try to figure out how to clean that up before you might have children. All right, so a lot of you are probably wondering, so how did it work out for Paula? Well, take a look. Take a look. This is just 2 of them because she actually has triplets.
3. The third one's at home.
Yeah,
so.
that thing of be careful what you wish for. 3 at one time.
3 at once.
Okay, and how did that happen for her?
Well, after she underwent one cycle of in vitro fertilization and then underwent the surgery, she tried 2 more times, and on the second time she was successful, as we can see.
Yeah, with triplets. And so, I know it's hard to put into words, but especially when you've tried for so long, what was that like?
Oh, it was just wonderful. Of course, when the nurse told me, she's like, I hope you're sitting down. Of course, I was laying down, but she's like, there's no way to tell you. You have 3. 3 heartbeats.
Yeah.
So.
And what would you say to couples out there who are struggling with this right now? I know one thing is don't lose sight of your marriage, but.
Right, definitely. We did get a few weekends away. My mother came to babysit, so we still get a few weekends away every once in a while. But don't give up, because I was ready to, after the second time, to just say, okay, that's it. We bless you. But the third time, if I wouldn't have tried the third time, I wouldn't have had the 3. So.
All right. Well, congratulations, Dr. Krotz. Thank you very much. If you have any questions about infertility or want to find out about all the services Dr. Krotz and his partners offer, you can go to their website at infertilityanswers.com, infertilityanswers.com. You can also call the center at 713-467-4488, 713-467-4488, and you could end up with triplets too. Right after the break. Hollywood's hottest